We don't want to leave anybody behind.
It's a no-brainer. I mean,
It's mutually beneficial.
Yeah.
Pretty
Right.
clearly.
Right. If it can help me and then help you
Yeah.
or somebody else, why not?
Hi, this is Patrick,
And this is Laura,
and you're listening to This is Cancer.
brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer. Okay, so I know today's episode is one, Patrick, you're going to be really passionate discussing because it involves clinical trials, something that you benefited from with your cancer treatment and your dad as well.
Yeah, absolutely. I was on a clinical trial for 2 years, and it was a big part of keeping, my cancer at bay, preventing recurrence. And my father was on several clinical trials with his melanoma at Siteman, and it gave him years of time left. I can't say enough about clinical trials. I talk about them all the time, so I'm looking forward to getting into it today with our guests.
Yeah, and we've had several guests on the show that have talked about being involved, and today we have a new guest who's going to share his story about being involved in his cancer treatment for prostate cancer. Byron, thanks for joining us today, and also you were on a clinical trial as well.
Yes.
And then I'm going to have to read this from my phone because this woman who I love dearly has a very long title. Dr. Lannis Hall, thank you for joining us again. You graced us on season one of our very first episodes.
It is my pleasure. It is so good to be back.
And you're the perfect person to talk about clinical trials because you are the Associate Professor of Clinical Radiation Oncology, the Director of Radiation Oncology at Barnes Jewish St. Peter's Hospital, Siteman Cancer Center, Director of Diversity and Inclusion in Research, and the Clinical Trials Leader Program to Eliminate Cancer Disparities, Washington University School of Medicine.
That's it.
I'm sorry.
Please do not apologize. Welcome, because this is something you've been wanting to talk about for a while.
I do, because it really does change lives and saves lives to participate on clinical research. And there's a lot of confusion and mistrust about participating on clinical trials. So I would love for us to talk about it today.
Yeah, we're going to get into all of that. But I first think we should start, Byron, with your story. And we should mention that this is the first time you've really talked at this level about your cancer treatment. You shared that before coming here, only your immediate family members and a few friends knew.
Correct.
So thank you so much for being willing to come and share your story, as there will be people listening to this that probably did not know that before today.
Yep, could very well be. But, it's just important to do whatever you can to help people, as I've been helped. And so I'm willing to go public, if you will.
I gotcha. Well, why don't we start with the beginning of your journey when you first found out that you had prostate cancer?
So that began, about 3 or so years ago. I had to find a new general practitioner. And I was fortunate enough to find Dr. Mejji at BJC. She ran a series of, blood tests and other things, just to make sure everything was okay. And she noticed that my PSA was high. She suggested that I reach out to a urologist. That was Dr. Lewis Thomas at BJC. He did more blood tests, and from the time that I had seen Dr. Mejji and saw Dr. Thomas, my PSA had risen even more.
How much time between the first test and then?
A couple of months.
Wow.
Couple of 2-3 months. So it was aggressive. Dr. Thomas, gave me all of my options. We spoke about it, and, it was either, you go through the radiation treatment right now or you have surgery to remove your prostate. And I chose to have the surgery. I knew the recovery would be shorter, although it'd be, a little bit more difficult at first, but it would be shorter. Mm-hmm. So I did that, and after a while and some testing, my PSA started to tick up slightly again. And that's when Dr. Thomas said, I'm going to get you with Dr. Lannis Hall, and you can have some radiation treatment. Won't be as extensive as, it could be because it's minor right now, and you should be fine. And then I met this wonderful woman, and went through the radiation treatment and as well as a clinical trial drug. And so far, I'm cancer-free and living a pretty healthy life.
I assume that the reason that you did the clinical trial was because you had the surgery and then your PSA levels increased. And so then you had to have radiation. And this clinical trial was designed to do what?
It was designed to hold hungry cancer cells at bay while, the radiation did its job and things like that, and increased my chances of,
Of making sure that
cancer-free.
PSA stayed down.
That's exactly correct.
And how long?
Can I add to that?
Yeah, I was just going to ask you a question about it.
So, Byron is, I call him a hero because he was willing to listen to why I thought this clinical trial would be a study he should consider. We did a previous study, a clinical trial that looked at radiation therapy to the surgical bed where the prostate used to be and comparing that to radiation to where the prostate used to be and the lymph nodes around it. And then the third arm, because it was a 3-arm trial, evaluated hormone therapy to potentially eradicate any metastatic disease, so disease that may have potentially made it into the vascular system that we could not see yet. So we call that microscopic, along with radiation to the surgical bed and into the pelvis. So lymph nodes, the surgical bed plus hormones versus less in the other 2 arms. And that study clearly indicated a advantage of the PSA not coming back and not having recurrence with all 3, meaning getting radiation to where the prostate used to be, where the pelvic lymph nodes drained that area, and hormone therapy for 6 months. So what Byron was evaluating was a clinical study looking at a better drug, a drug that had been shown to improve survival for men who had even more aggressive disease, meaning their disease had already spread to other parts of their body. And so it was FDA approved for those men because it had extended survival. And the question was, adding this drug for just 6 months to Byron's plan of radiation, would that improve his outcomes over the 85, 87% report that I'd given him that the standard of care would have been? And he was like, hey, I want to try to get higher. Plus, I want to move this whole disease forward and cure more men, and I want to be part of the solution. And so he was really like, of course. He was like, I want to be part of the solution, because we marched through what we had learned over the last 20 years with first radiating after, is that beneficial or not after surgery if your PSA starts to recur? And we found that was giving radiation in a postoperative setting was beneficial. Then we added hormone therapy, found that, hey, just 6 months of hormone therapy improved outcomes even more. And then the question was, hey, what about this newfangled hormonal therapy? Is that even going to help further and get us up in the 90 percentile or 100? And that's what we want to do, right? We don't want to leave anybody behind. So he was willing to be part of that whole trial history of getting us to 100%.
It's a no-brainer. I mean,
It's mutually beneficial.
Yeah.
Pretty clearly.
Right. If it can help me and then help you or somebody else, why not?
You didn't think this sounds too good to be true. What's the catch? You didn't go, well, let me ask a million questions first. You just went, well, if that's good enough for me.
Well, no, I mean, of course I asked questions, as everyone should.
Yeah.
But I also felt fortunate. I was already engulfed in, the BJC world and, having good outcomes, if you will, for my condition. So I was already in a position where, okay, I'm going to trust these people. Sure. And then when I met Dr. Hall, the way she explained everything, and my wife was in the room, with me, and she asked many questions. And,
Many questions.
Many questions.
That would be me.
Yeah,
Roll out the
she
paper.
asked a lot of questions. So it was a pretty easy decision.
And so you engaged. Well, when did you first enroll in the clinical trials? This pretty immediate post surgery, as you're getting into radiation. You paired it with this clinical trial.
It is a combined treatment approach. So
Yeah.
at the time of the consult for radiation, it was the discussion point. And I want to just make a point about the fact that Byron was willing to do this study, and either he was going to be assigned to the standard hormone therapy that is guideline-directed care now, or the new medication. And a lot of people fear that a clinical trial means they're not going to get treatment of some sort, or they're going to get a placebo. And there's a good reason for there to be a lot of mistrust about clinical trials, because in the past, some clinical studies have not been conducted ethically. So that misconception really has to be stated at the outset, that regardless, you're going to at least get the guideline-directed care that
The
we would
standard of
give you,
care.
the standard
She
of
was very
care.
clear about that.
But we are evaluating a drug that has looked very promising and already approved in a more aggressive situation, and we want to see if it benefits you.
Sure.
A lot of our studies are that way, but because of past abuses, many people are very reluctant to even hear the word study.
What do you mean by past abuses? Like from certain, like hospitals, or just from flawed research from years back? What do you mean by that?
So I feel like I say this all the time, but I realize a lot of people know something went wrong in Tuskegee,
I was just going to say Tuskegee.
but they don't really know what happened. And that study is always brought up because almost every tenet of ethical research was broken. It began in 1932 in Tuskegee, Alabama, with men who had syphilis. They didn't know that they had it, and they were told they had bad blood. And they were supposed to be monitored for just a few years, but this went on from a few years to 40 years of not being treated for syphilis. And syphilis has different stages and progression, particularly in the brain and in the neural system, and it's devastating and infectious, right? Because they were told they had bad blood, the reason that they would come at all is because they were given aspirin and it made them feel better. But they had lumbar punctures and other blood tests and just some difficult procedures and autopsies at the time of death, of which many died over that 40 years. So you might say, how is this even possible? Because penicillin, which is the treatment for syphilis, was widely available by, the 1940s, and Public Health Service was indicated to treat people who had these infections. And they were actually restricted from receiving that care from even their primary doctors. They would say they're in a study, so do not treat them with penicillin. Let's say you have pneumonia, bronchitis. Guess what we were using? Penicillin. Couldn't treat with that drug. So they would go to the doctor with other ailments and would get restricted care. And this went on until 1972 till a reporter broke the story in the Washington Star. And so they didn't have informed consent. A clinical trial has to have beneficence, meaning it has to have more good than it ever would have bad. And it didn't have that, obviously. And most importantly, they withheld a treatment. For example, if there was some new drug that had developed that was proven to be even better than what we were evaluating, in Byron's case, we'd stop and give them that. So you have to first do what's best for the patient. And none of that was done. And so because of that, 40 years, Senator Ted Kennedy, if people, I'm old enough to remember him, held hearings, and there is a way that we have to conduct research now where that can never happen again with, a review board as well as informed consent, which Byron remembers, which was like 15 pages long.
Oh, sure.
I thought I was buying a house.
Right.
And but we've come full circle where people who participate on clinical trials because they are getting standard of care or new and very exciting and treatments that are advancing us usually do better than people who aren't participating on clinical trials.
Or go to a hospital that has clinical trials.
Yes.
Right.
That's what you said. Don't go to your neighborhood or around the hospital. Go to the place that has research happening, because if there's research happening,
then they know the latest and they know the standard of care
That's
for every
something
situation.
I was not aware of previously.
Yeah, just to make it clear for everybody, when you are in the standard of care, like, for me with lung cancer, it was, okay, you have this kind of lung cancer, so let's go to the board here. That means you get this kind of treatment. That means we check you with a scan every 6 months. We do blood work every 3 months. That's the rubric for this treatment plan. But when you engage in a clinical trial, you then get the benefit of having more eyes on you, the need to monitor you more closely. So it's more frequent blood work, more observation, which, I don't know, I suppose you could hear that and go, oh, geez, I got to go to the doctor more. But it just means there's less time for stuff to start brewing and things to start turning in the wrong direction because you're going to have eyes on you. It's an improvement from the standard of care, which these clinical trials, the goal is to become the new standard of care.
When you started taking, you said yes to the trial. Did you have any real concerns about side effects that you knew were coming down the pipe? And then when you started having the side effects, were you like, well, this was a little more than I bargained for, or was it less?
It was more.
Yeah.
They explained, hey, here's what we've seen. We've seen some of this and some of that, and this could happen, but, you could be different. You could maybe not have any of these. You could have all of these. You could whatever. And so okay, let's just do it. Soon after that, because until that time, I wasn't experiencing any side effects, or I didn't, they weren't prevalent at the time. And soon after that appointment, I started to experience some side effects. I started to notice, the hair loss, and not on my head and other places, but my chest and my stomach, right, and under my arms. And I'm just like, okay. And then I started to experience some severe pain in my left hip. So much so that, I contacted, Dr. Hall and Scott, and they were like, yep, it could attack some vulnerable places in your body. So if you've had an injury or something else, it could attack that. And I have osteoarthritis.
I see.
And so it attacked that, and I couldn't walk upright, and I think that was the worst of the side effects. My appetite was still fine. Libido was still fine, but physically I just couldn't move well.
So how did you move? You said you couldn't walk upright. Did you have to lean over forward or to the side?
I did. I had to lean over forward, and my wife was like, you look like you're 90 years old.
Yeah.
And I'm like,
just doubled over.
I just, I couldn't do it. And I'm still working on the range of motion on my left hip, and I can walk upright better. But not only did I
get a cortisone injection?
I did get a cortisone injection.
Yeah, I think that helped.
Yeah, it helped me.
And if you're not
immensely.
moving it, you get that frozen hip or socket when you're not moving things.
Again, the benefits of a clinical trial, though, because that what's getting measured will be managed. And so
absolutely.
If you go in there and you're going, well, because I'm in this clinical trial, I'm going to see you more frequently. And by the way, my hip is hurting. Well, let's do something about that.
That's exactly correct. And I got, immediate response.
You're forgetting a big side effect.
So Muscle mass. I lost, and I'm not the smallest guy in the world, and, playing football and other things throughout my life, I used to be, kind of muscular. Man, it zapped a lot.
Did you do the weight training we talked about?
I did, but it was difficult because I was getting weaker.
Yeah.
Even while I'm trying to go to the gym, I'm still getting weaker. And it's discouraging, right? It affects you mentally and all of that. And then when I was a little debilitated with my hip, well, I'm not going to the gym at all. And before that, I had a routine. I'd play pickleball 2 to 3 days a week and, just lift weights or whatever 2 to 3 days a week. And all of that left. So,
where are you now?
So I'm back to playing pickleball.
Yeah.
I'm back to doing push-ups, and that sort of thing, and, being more active.
Yeah.
How long was your clinical trial?
6 months.
6 months, whole thing. Okay.
Yeah.
And Patrick, when we had our pre-interview call with Byron, you were sharing some of the side effects that you had when you were in your clinical trial.
Yeah.
What did you experience?
Different than you, but I mean, I'm sure there's some crossover, but I mean, fatigue, nausea, diarrhea. I would, get these like hot flashes. I guess I would just start like pouring sweat.
That was the worst one. Okay,
Now
not
you
my
remember.
hip. Let's go back to that.
Yeah, you just be like,
The menopausal effect. I'm just like, what is going on?
And can you describe what those feel like in your words?
Hell. Just falling into hell
But-
immediately.
just flop sweat.
Yeah.
Right?
So,
Okay, because you're going to...
okay. I'm sorry. All right.
It's okay.
Cut that. Okay.
No, it's okay. Because
But-
women try to explain this all the time, and I'm so interested to see what
And
you
I
think.
so understand. And my wife is like,
Yeah.
oh,
I haven't.
like that.
I have not seen a wife that wasn't smiling from ear to ear.
Oh,
I'm just
Like, know my pain.
You're saying it, and I'm like, deodorant doesn't even. You need to have like it around all day long because you'll just start sweating.
It really
No,
wasn't so much under
no,
there.
it's not that. It's like,
Yes.
like shoulders to head, whatever. So
Just-
if I'm in bed, I need another pillow
Yep.
because that one's I'm waking up. Okay, I gotta turn it over or something because that's soaking wet. Or when we're just out and about, walking through Target, and I gotta stop and I go, where is my towel? Where's my rag? And I carry one, and I'm just like.
We have medications
heaving up
for
and
that.
sweating and all of that. And she wanted to give me another medication that would stop that.
But at a certain point, you go, I'm all about the clinical trial. I just don't need any more medicines.
I don't. That's exactly
My pill bottle
correct.
runneth over.
Exactly.
I think, yeah.
I was just like, you know what? I'll gut through this.
And we have the right to be stubborn about that stuff.
Yeah, but that was your worst side effect, and you could have taken medicine for it, and you didn't.
I just want to be clear that the doctor recommended this.
Yeah, let's be very clear.
medication.
Clinical trials, often there's help for the side effects, but said guest said, I would rather go through hell
I knew
than
that
take
it was
the medicine.
temporary, and it's not like. All right, the hip pain was probably the worst because that was constant.
Yeah.
And it wasn't all the time. And it would occur, at first once a day and then twice a day and then 3 or 4 times a day and certainly once or twice at night.
Yeah, it's inconvenient.
It was extremely inconvenient.
And then you get people going, you all right?
Exactly.
You all right?
All the time.
Yeah.
And,
yeah.
and when you're in St. Louis and it's 100 degrees and you're
humid.
playing golf and it's humid and you get a hot flash, I'm telling you, there were times I just wanted to take my shirt off. I'm just, I just wanted to just disrobe.
And when your friend's like, what's going on, man?
You just got to get through it.
Someone
right?
goes, let's sit outside. It's nice out. You go, no.
And they usually
They've got air
last
conditioning.
about
That's right.
2 or 3 minutes and go
Yeah,
away.
about 2 or 3 minutes, and it's gone, and then you're fine.
Yeah, those are tough.
Like, oh my gosh!
Mm-hmm.
But
I was
so
right there with you.
man,
This might be a dumb question, but I'm always willing to put them out there. Do you ever do clinical trials and give them drugs that you don't know of any side effects that they might even have? Because every drug you see on commercials, let's try this, side effects may include, and they spend half of the commercial talking about the side effects of the drug. So There must be a trial before I know there is, before you give those drugs to know what side effects are going to happen.
We have phase 1, 2, and 3. And phase 1 are clinical trials that are trying to evaluate just the safety of this new drug. Might have had animal studies that have shown some activity, but it's the first time the study is being performed in humans, and so we're just trying to understand dose, and we're not even looking at effectiveness, just safety. And then phase 2 studies really are looking at, is this an effective treatment? And many times we're still collecting safety data as well as, is it effective for the specific disease that we're treating? But the vast number of studies that we're talking about today are phase 3 studies, where we have shown that it's safe and that it's effective. And now we're trying to determine, is it a better treatment than what is our standard of care? And so we do have some studies that are a combination of the two, where we're looking at they're called phase 2/phase 3 studies. But, Byron was really participating in a study that was looking at 2 questions. We were only answering one, and that was that new medication, the pill that he was taking. But if he had come and had spread to another part of his body, we were also looking at giving a high dose of radiation to that small area that the cancer may have spread to see if that would be more effective than not treating it because of a new diagnostic test to pick up on very small areas of disease that we did not have before. So it was a number of things that were going on with this study, but the great news is that he didn't have metastatic disease, and we were really just trying to make sure that we sterilized the rest of his bloodstream so he wouldn't develop metastatic disease.
Right.
Yeah, it's, again, I always describe it as it's an edge that I just think anybody would want. And I mean, phase 1 trials have their place too. You might be up against it with something where it's, hey, this is a nasty cancer. We don't have a 2 or 3. We've tried this, but we will treat you if you want to treat this. And we think the next thing, you got to mix it up here. You can't keep running the same play.
Right.
So that's where phase 1s come in. And if you're lucky, 2 or 3. So,
but how hard is it to get phase 1s? I mean, that's the hard part, right?
Well, that's why you really have to be an educated consumer. You cannot spend more time looking at a vehicle and going to a couple car dealerships or looking online than you would for your own health. And Siteman, for example, has 9,000 people who are right now participating in clinical trials, and we have over 700 clinical trials, and many of them are phase 1. And so when you might be at that step in your cancer journey where you've exhausted all standard treatments, but you still want to have options, that is absolutely when you need to go for a second opinion. But I would suggest to anyone, when at the time of their diagnosis, they should have a second opinion if they have not been to a center that has the number of clinical trials that Siteman has. Because many times you, again, are going to have something like Byron's study where there's a new drug that looks very promising that you could have access to that may be a legitimate lifesaver.
Won't you as physicians also, if you know of a clinical trial happening somewhere else, say, I know of this trial?
Absolutely.
It's not just, I'm only going to offer you what's here. If you have colleagues or you know of a study that they fit the criteria, which is also a very important part of being in a clinical trial, and we'll talk about that in a second, criteria matters, that you will say, hey, there's something happening at so-and-so hospital, and I think you could be a candidate. Let me try and connect you.
We do that many times, particularly when we don't have a trial to offer at Siteman. And there's a couple places that it's easy to kind of look. We have the ability to look throughout the country for a study.
You see, they do that, but not every physician will do that. There's always that human element. I always, talk about if you call some big company and you get customer service and your issue doesn't get resolved, you can call back and another person can resolve it, right? So it's really about that person. So that's why it's important that you do your own homework and not only depend on your physician to tell you what's out there. Ask questions, of course, but
and
then
bring
do some
someone
research.
with you.
Always have an advocate.
Have an advocate with you. I can't stress that enough. It's shocking to have a cancer diagnosis.
Totally.
You will go into an appointment and you're just thinking about what does this mean for my life, for my family, for my work, and you're not hearing half of it.
Not hearing it, right.
And you have to have someone else. And I would even suggest someone who's a cancer survivor who kind of knows the journey and what to ask so they can advocate with you.
What about clinical trials that you could possibly be on at the beginning of your treatment that, if you're first diagnosed, we talk about the standard of care, but clinical trials are not only done at the end of someone's possible cycle, right?
No.
They can be, we've found that when we treat this and do this and this, right?
Like in tandem.
So can I just give you a quick history for?
Oh, yes, please.
About 20 years ago, when Byron would have been diagnosed with, if he was diagnosed back then, we would have offered 8.5 weeks of treatment if he had decided to do radiation. And he may have received hormone therapy with it for 6 months. And then we did a study looking at, do you have to give 8.5 weeks of treatment now that our technology is better and we can be more precise in our targeting and avoid critical structures like the bladder and the rectum? So we did a trial of comparing 8.5 weeks to 5.5 weeks of treatment and found that 5.5 weeks was just as effective and no greater side effects. Each day we were giving a little bit more radiation, and the prostate cancer is very sensitive to higher doses of radiation. So then about a decade ago, a little bit more, we started looking at placing these markers into the prostate gland to even localize more precisely down to 1 millimeter, and more recently placing a little water pillow right behind the prostate to push the rectal wall back so that you can avoid the rectum, and giving treatment in 1.5 weeks in 5 treatments.
Wow.
Monday, Wednesday, Friday, Monday, Wednesday. So the standard of care for intermediate risk prostate cancer now includes 5 treatments, and it's the majority of the way I treat now. So I have gone from when I trained, giving treatment over 2.5 months every day, 44 treatments, now down to 5 treatments, Monday, Wednesday, Friday, Monday, Wednesday, every other day. And that's all because of clinical trials. And these are men who were diagnosed at the beginning. So most of the people that I talk to about a clinical study are people who are newly diagnosed.
Wow. That's so interesting.
So just think about if we one of the biggest, problems is remembering to recommend a clinical trial to your patient. So I think if all of the studies we had were actually offered, we'd have even more people on clinical studies. The problem is doctors are busy. They might, let me just get this scheduled, and may forget to offer that clinical trial.
Is that a question that you would advocate anybody ask when they go in to the oncologist?
You've got
That's just a standard question. Are there any clinical trials that you think I could qualify for?
Yes.
Because they might. The answer could be yes, and your oncologist might be jammed up that day.
Yeah, and it may trigger your oncologist. So sometimes just saying, hey, can we go over those clinical trials again? I'll be like, oh, yeah. And that might be all it takes.
I can't stress enough the importance of doing your due diligence to potentially give yourself that edge. Because, you and I are living proof of the edge that a clinical trial can give you. And if there's a place that has 700 of them, that you could go talk to somebody and find out, you know what, actually, I'm sure your oncologist is lovely, but we could offer you a whole heck of a lot more because we have this giant engine of clinical research behind us that we can put to work for you. I just don't think people know that.
Even though you ultimately may decide, hey, doc, I just want standard of care, investigate it. You might find that, yes, I actually want to participate on this study. So look at it this way. Do you usually go to the first house when you're going to buy a new house? Do you usually go to the first house and say, okay, this is it. I want to buy it. Let's just go. No, you typically look at a number of homes, evaluate the price, decide what's the value, what's best for you. Why would you do more for living in a house than you would do for your life?
Right.
That's the key word, life.
Yeah.
I mean, what's more important?
Yeah. Dr. Hall, you said this, when we first taped season 1 about asking not only when you're with your oncologist or at the hospital or wherever you are getting your diagnosis, not only what clinical trials do you have to offer, but do you have clinical trials? Right. And if they do not have clinical trials at that facility, that is your number one red flag to say, thank you, listen to what that doctor has to say, and go get a second opinion at a place that does.
Absolutely, because what you will recognize about the physicians who participate in clinical research every day is that they're talking the standard of care and advanced treatments all day long. So even if there's no study really available for me, I know I'm about to get the best guideline-directed care there is, because this is all they're doing every day.
So I'm curious, what is, now that we've sat here and talked, Byron, what is the thing you want most for people to understand through your story after they listen to this?
I would say educate yourself and be open. Don't let some of your past thoughts hinder you from saving your life. Talk to your doctor, ask questions all the time. And if you have an advocate, have that person with you as much as you can. And, live your life and be happy. We talked about sometimes how attitude itself can prevent something. And a positive attitude is a start.
What about you, Dr. Hall?
I think Byron is an excellent example of the saying that I like, that your body hears everything you say. You have got to be positive, and you've got to support yourself and be good to yourself.
Yeah.
And Byron just exudes that. And I'm thankful for him. I consider him a hero.
Not as thankful as I am for you.
Because it's easier to just say no. It takes a little bit more to be open and to give yourself some space and some grace and an opportunity to have the best outcome. It takes a little bit more time.
Yeah.
It does.
And I appreciate him for that.
Patrick, what about you? I know you're pretty passionate about this subject.
Oh, I mean, this is a success story, so I love hearing it, and I love hearing Dr. Hall's expertise and take on all of this. It's stuff I wish people knew more about. I don't think it needs to be this big scary entity. I was curious, Byron, your impression of clinical trials before and after. In my case, I thought I would have to go to a dusty book and open it up and start doing research and piecing things together myself, or from my dad, for that matter, to help him out. But really, it was just asking questions and then getting plugged into the right, study through his physicians. But did you have a big shift in your impression of clinical trials?
I did, for a couple of reasons. First of all, when you're healthy, you don't hear any of this, right? It's like a commercial that you can't even hear. And if you do, you're like, yep, a bunch of guinea pigs, right, that are going to do this clinical trial. But then, you get older, you see other people go through things. I've lost both of my parents. My wife has lost both of her parents to different things. And so by being part of their education and going through what they went through, you open your mind to more information. And I was fortunate enough to, not only do that and have a wife that made me do that, but to be around at a time where the resources available to me are extremely effective.
Yeah.
And so, timing is a lot. And, and now, better than any other time is the right time to be inquisitive.
My father's oncologist at Siteman would always say at the end of our appointments, because he was in clinical trials, he would say, thank you for furthering the science by taking part in this. So thank you for furthering the science to both of you. And thanks for coming in to be on this episode. It's a really important issue, and I hope people really listen.
It's been a pleasure.
Thank you, Byron.
You're welcome, Doctor. Thank you.
You're welcome.
Thanks, guys.
Thanks for listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis.
National leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu and be sure to leave us a review and like and subscribe wherever you listen to podcasts.